It's a Northwest News Radio weekend. IRG's Health Talk continues.
Our first guest, Dr. Jessica Schule, naturopathic doctor with Rebel Med Northwest, speaking out about chronic digestive issues. It's called SIBO, small intestinal bacterial overgrowth. And Shannon, all kinds of stuff that can go wrong internally. And these digestive issues have hit a lot of us.
Yeah, Tom, you just look around and everybody has certain digestive issues or complaints of digestive issues. And what we're finding out is the bacteria in your gut is so important for proper digestion and care of your stomach, right? And so Dr. Schule is going to talk about this kind of stuff.
Here she is with Shannon O'Kelly.
Dr. Schule, how are you?
I'm good, thank you. How are you?
I'm doing wonderful. Hey, welcome to Health Talk. We're going to chat a little bit about SIBO, chronic digestive issues today. That is our topic. But before we get into that, I always like to kind of find out about your practice, kind of your background, your interest, your area of expertise, specializations, all those things for our listeners. Tell our listeners about Dr. Schule, okay?
Definitely, and thank you for having me. I'm really excited being here. So for myself, I grew up in Saskatchewan, Canada, and so for me, my childhood was predominantly playing sports, and if not specifically soccer. So for me, growing up, I was very injury prone, and so for playing at very frequent levels, and if not at a competitive soccer level, I was constantly injured. So this led me to lead to my recovery and rehabilitation avenues, specifically for my knee injuries. So I was very fortunate at that time with my soccer team to have nutritionists, physical therapy, and other trainers to help aid in my recovery. Along with this, I'm also Indigenous and grew up in a very strong Indigenous household. So we collectively as a family had traditional healers. And so we were definitely integrating native medicine into our lifestyles. And so I had traditional healers also part of my healing process and my recovery, and aiding in herbal consultations, herbal topicals, and just making sure that nutrition was a really big key aspect of my health, specifically at 12, 13, 14. It was a really big learning tip from my mom about what was going into my body and if not onto my body, so that I can get back into sports as soon as I could.
Wow, that's an interesting background. That is awesome. So where'd you get your education? Where'd you go to school to become a naturopathic physician?
Yeah, so I went to the University of Saskatchewan in Saskatchewan for a 4-year Bachelor's of Science in Biochemistry. I then continued on to my medical program in New Westminster, British Columbia, completed a 4-year degree at Boucher Institute of Naturopathic Medicine, now known as the Boucher campus of the Canadian College of Naturopathic Medicine. After graduation, I jumped down here in Washington State, and I also completed my 3-year acupuncture program. It is my Master's of Science in Acupuncture, just graduated recently.
Wow, what a journey. So let's talk about our topic today, SIBO. Tell us what that is. Let's set that up.
Yeah, so most of the time when patients come in, they've had some form of chronic digestive issue, and this can vary in time length depending on who that person is and how they're experiencing it. Commonly, these signs and symptoms are going to be abdominal pain, gas, bloating, any form of irregular bowel movement. So if that's diarrhea, constipation, and if not the best form of a mixed. And then some of my patients also have nausea and vomiting. So it's a very big catch-all digestion concern. And most of the times these individuals get diagnosed with irritable bowel syndrome and then kind of lost within the medical system.
But tell us what SIBO, what does the acronym stand for there?
Yeah, so SIBO or SIBO is standing for small intestinal bacterial overgrowth. We typically have general bacteria in our gut. It's very immunoprotective. So we do have good amounts of Staphylococcus, Streptococcus, E. coli, things that we're very commonly aware of outside triggers for food poisoning. But we need to have a small amount of that inside our body so that our body is very aware, immunoprotective wise, to make sure to know and what amounts to be regulated for. Commonly what's happening with my patients is they're eating standard American diet, and if not in terms of binging on weekends, and if not just having indulgent days, Thanksgiving, Super Bowl, etc. They just have too much of something that's too good, and that's where that off-putting scale in terms of increasing that overgrowth of bacteria. So the overgrowth of bacteria then leads to these signs and symptoms, which are commonly diagnosed through specialty labs.
More with Dr. Jessica Schule and Shannon O'Kelly next on Northwest News Radio.
It's a Northwest News Radio weekend. Here's Tom Hutler and Shannon O'Kelly. This is IRG's Health Talk.
Our conversation with Dr. Jessica Schule continues with Shannon O'Kelly.
Dr. Schule, again, thank you so much for joining us in Health Talk. And thank you, for having this topic and discussing this topic. I can't tell you how many people I know that experience this. And it's interesting that you're talking about this bacteria in your gut, how important it is, because I'm reading all the time that little changes in that bacteria can affect your digestion. And also, I'm also reading that bacteria can lead to things like maybe autoimmune or some other inflammatory issues or diseases. Let's talk about that gut thing.
So commonly what ends up happening is people have these types of symptoms 6 months and if not longer. Commonly in my practice, could this be less? Of course, and can it reoccur? Unfortunately, it is likely, but it all depends on that education piece and that awareness of how it's triggering people. In terms of that digestion piece, and you bring up a really good point about autoimmune, the digestion tract is so important for everything and anything. It helps break down our nutrients. This is converted to energy, helps with cellular growth, and helps with cellular repair. So with this, these are the building blocks to our immunity. And you're talking about our autoimmune conditions. This is also building blocks to help with our neurotransmitters, hormones, detoxification pathways, and elimination. So it kind of builds up a bucket theory and it outpours and it just overflows into a lot of different bodily symptoms that then create these catch-all. It's affecting the whole body.
When you see a patient and you can diagnose or help them, what kind of interventions are you doing? Obviously, I'm sure you're talking diet, maybe some lifestyle changes, but what else are you doing? Maybe talk about that.
Yeah, so here in Washington State, I am a primary care physician with access to pharmaceutical medications. So some antibiotics are actually very useful and helpful in this case scenario, depending on the person's background, their history of antibiotic use, and if they're a good candidate. We can use pharmaceutical interventions only, or I talk about naturopathic nutraceutical interventions only. And so that would be our botanical blends, our nutraceutical, looking at food as medicine as well as part of that. And then my third option is creating a hybrid, and it's blending the two, the pharmaceutical world plus the naturopathic world, depending where that patient is with signs and symptoms and how fast they want to see results.
How many people do you think are maybe have gluten problems or gluten sensitivity, or assume they have gluten sensitivity, that maybe they have other digestive issues? I mean, because that seems to be something that's very popular. Do you see that?
Yes, and I honestly would go with a 50-50 split, because depending on the person that is in front of me, you either do or you don't. And in terms of going into the line of celiac disease versus gluten sensitivity, we have to look at that person's lifestyle in this present moment of how is their stress, how is their work, how is their interpersonal relationships, on top of their sleep, their diet, their nutrition, etc. And can they tolerate said gluten item regardless of what is common in their diet and their cuisine versus somebody else around them.
Yeah, this is really interesting stuff. Dr. Schule, we are going to have you back. I so appreciate the fact that medicine in today's world seems like it's all about collaboration, and it is so good for the patient that we're talking about, things like lifestyle medicine and maybe some diet changes, nutrition, exercise, wellness. I mean, I think we got to a point where we were relying on just pharmaceutical type stuff so much, and this expansion into kind of bridging holistic and traditional medicine is very important. I appreciate what you do. Thank you for your time.
Thank you. I really appreciate this.
You can get more information on Dr. Schule at rebelmednw.com. Shannon, interesting topic there about bacterial growth inside and what it means for us.
Oh, it's totally interesting. I mean, if you look around, like I said, Tom, just talk to friends and family and find out how many people have these digestive problems. I mean, is it gluten? Is it bacteria? Is it your diet? So she's there to help.
Our next guest right after this time out on Northwest News Radio.